Some people who have had COVID-19 are experiencing long-term effects from the virus. It's known as long COVID or post-COVID conditions. Lily Cedardahl spoke with a local resident about her journey with long COVID and as well as with health experts and what they say about this condition. Lily.
Long COVID is a wide range of new or ongoing health issues that people experience after first being infected with COVID. These are conditions that happen after the acute phases of the virus. Those I spoke with today say the effects of the condition impact day-to-day life.
To say COVID has completely affected my entire life is an understatement.
Wabash Valley resident Carla McLoon was first diagnosed with COVID-19 August of last year. McLoon says while she didn't have symptoms the first 5 days, conditions started to worsen shortly after.
I was diagnosed with COVID pneumonia. I was in the hospital for 21 days. I don't remember 10 of the 21 days.
McLoon says after being released from the hospital, she was on oxygen for 18 weeks and has had a long recovery.
I now have to take medications on things that I didn't have to take medications before. I suffer from a great deal of fatigue.
Along with the fatigue, McLoon says brain fog and muscle pain are also lingering conditions she faces almost a year later.
I am exhausted all the time. I work 8 to 4:30, and most of the time after work I go home and take a nap before I can do anything else for the day because I'm so tired.
Chief Medical Officer at Good Samaritan Hospital, Scott Steen, says while effects like brain fog and fatigue are common indicators of long COVID, he says many patients may have debility from the severity of the virus.
Thankfully, the number of people that we've seen that truly meet the criteria for long COVID is relatively small. A lot of the initial diagnostic challenge is, first of all, establishing that they had the infection, how long the acute phase of the infection was, and then when they started noticing their symptoms.
Dean says typically doctors will start looking at long COVID as a diagnostic possibility 2 to 3 months after the initial illness.
Fatigue is one of the major rate limiting factors in getting better. And so getting in touch with a primary care provider and being evaluated is important to determine if there's anything we can do to help with that.
According to the CDC, ongoing health problems due to long COVID can last weeks, months, or years.